joining. Let me also introduce Winnie Bayanima. She's the Executive Director of UNAIDS. Winnie, good to have you on the show. You know, there are some reports that we have been mentioning and reading about. One is, of course, the International Labour Organization that speaks in the context of India and says that lockdown or an extended lockdown will push close to 40 crore people below the poverty line, or push them into poverty in a country like India. Unemployment in the country is going to, this is CMIE data in India, which says that unemployment will be at 23.4%. Do you suggest that with these indicators of large-scale unemployment, of poverty, this is bound to create a health complication as well, too difficult for a country to deal with?
Absolutely. This is a human crisis at an unprecedented scale. It is devastating. It's taking away lives, it's taking away livelihoods, and it is destroying economies. So there are three aspects to it that we must fight at the same time: the loss of life, the health impact, the social and economic impact. 1 million cases, there are now more than 1 million cases across the world of people infected, 100,000 deaths passed, roughly 3 billion people, almost half of the world's population, is in some form of lockdown around the world. It's huge. And the IMF has said we are entering a global recession. So we're talking about a situation where millions are already being pushed back into poverty. In your country alone, the millions in the informal sector who work and earn daily now don't have food to eat every day. It's huge. But we can get out of it. We can get out of it by taking the right measures, that is the prevention measures, the washing of hands, the isolation, and governments moving very quickly to beef up their health systems and begin to trace, isolate, treat. There's no other way. And we cannot come out of a lockdown before we are sure that we are controlling the epidemic.
Now, that's a very significant point, Anjali, where Winnie says that you should not come out of a lockdown till such time that you are able to assure the people of healthy efforts as well as means of, you know, kickstarting the economy or getting them out of poverty. Absolutely. Now, that's a very tall ask.
Absolutely, and I'm sure there are things that we as society, governments, everybody has learned from our earlier challenges. Winnie, what would you say, what kind of learnings can we take from the response the world had given to HIV?
Well, we have learned a lot. 25 years of fighting an epidemic, HIV, we learned a lot. For example, we know that it is so important to empower communities and put them on the front line to fight. If you drive it from the national level or even from a provincial or district level, but don't empower communities, you've lost the battle on the ground, and that's where it is. Two, we know that you must never compromise on human rights, because actually the people who are most vulnerable are often the very ones whose human rights are trampled on in society. And if you don't start there by respecting their human rights, upholding them, you will never beat this epidemic. Third, we must not accept stigma and discrimination. Stigma and discrimination drives the people who need to come forward away. It's counterproductive. You need to fight discrimination. If you say it is coming from them, they are the bad ones, then they will not come forward for testing. It's just no-brainer. Fourth, it's so important to support vulnerable and marginalized groups in a whole way, because you can't, it's a false choice if I don't have food and you're telling me that I must stay indoors to protect for public safety, not to spread the virus. I need food and I need prevention.
Absolutely, Winnie. These are some really important issues.
Very important points.
And the fact that
and you know, in a weird way, we are facing all these problems right now. It's happening right now. There is a food crisis. there is a crisis of people being hungry, and also there is the point on stigma. All of this is valid. Vinny, thank you so much for joining us on this broadcast.